Hello everyone. So let's begin the today's topic, major openings of diaphragm. So let's begin with a case so that we can have a better understanding of the topic. A 70-year-old male presented in the emergency with sudden onset retrosternal chest pain, breathlessness on exertion, and trouble swallowing the food. So you might be wondering what's going on in the patient. On ordering the routine investigations, chest X-ray showed the classical presentation which is visible here, something which revealed the diagnosis easily. Some of you might be able to guess it right now. We can see here an appearance of air fluid level superimposed over the cardiac contour. If you can make out, this is the heart shadow and we can see the gastric bubble which is superimposing the cardiac shadow. Normally, as we know, it is present under the left hemidiaphragm. So this is a case of large hiatal hernia. As you might be wondering, what is the normal anatomy of the chest X-ray? So let's have a brief outlook at that as well. This is an image showing the normal chest X-ray. We can see the cardiac shadow with the well-defined borders. We can appreciate the borders of the heart very well. The left atrial border, the left ventricle, the diaphragm being here, and then we have the right atrium at this level, and then we have the superior vena cava showing the shadow here. We also see the aortic arch, the shadow here, and the pulmonary trunk. And here we can notice the gastric bubble which is clearly shown here. This is a shadow of the stomach and this is the gastric bubble. So in the case which was given to us, we could see this bubble not present here, rather it was present superimposed on this cardiac shadow. So I think now you can make out that there is some problem which happened with the herniation through this diaphragm. So you might be wondering now, are there any openings in the diaphragm? Oh yes, there are some openings. And by now I think you have a fair knowledge of the understanding of the chest X-ray which was shown to you. Yes, you are aware now. Let's see the anatomy behind it. This is the right lung, this is the left lung, right bronchi, the left bronchi, and this is the diaphragm which separates the thorax from the abdomen, and this is the trachea, the windpipe. So I think you have a fair idea about the diaphragm, its location, its presence. So let's jump on to our topic. We will see an image of the lateral view from the left side to understand the levels at which the openings of the diaphragm are present. We are focusing in this video about the major openings of the diaphragm. So this is an image showing the different levels at which the openings are present at T8, thoracic vertebra 8, T10 and T12. We have to remember in the same sequence for our easy understanding. And this image, let's understand what this image is representing. So this area is represented is the sternum. This is the diaphragm which is shown here. Let's see the levels of the three openings. So first we have the caval opening or the vena caval opening, which is present at the level of T8. As the name suggests, the inferior vena cava passes through it. The second major opening, we have the esophageal opening or the esophageal hiatus, At the level of T10, as again the name suggests, the esophagus passes through this opening. Lastly, we have the aortic hiatus. As the name suggests, again the aorta will be passing through it, the abdominal aorta, and then further we can see its branches, celiac trunk and superior mesenteric artery. Let's see the same things but in a much different view. This is an image showing the diaphragm from below, and let's understand the other labels. As we know, this image is relatively very common in all the books of the anatomy. You will be finding these images, and let's understand the basic structures first before understanding the three major openings in this image. So here we can see the right crus of the diaphragm extending up to the lumbar 1, 2 and 3 vertebra, and then here we have the left crus of the diaphragm extending from first and second lumbar vertebra. Now let's look at the three ligaments. First one is the median arcuate ligament. Pay attention to the word median. It is present in the midline in the center where the two crura are connected, and this crosses over the aorta. This red color structure is showing this is the aorta. Next we have the medial arcuate ligament. Do not confuse it with the median which was just discussed. And lastly we have the lateral arcuate ligament. So we need to know these few structures, the crus of the diaphragm and the arcuate ligaments, to understand the openings. Now, as we discussed, there are three major openings. The first one was the vena caval opening, second being the esophageal opening, and third being the aortic opening. And now in this image we can also appreciate where these openings will be. So as you can see this white portion of the diaphragm, again this image is taken from below part of the diaphragm as the view from below, and this caval opening is inside the central tendon of the diaphragm. This is very important to know. And we have the esophageal opening which is present in the muscular part of the diaphragm, as you can see in this image very well, with the brown color representing the muscular part of the diaphragm. And thirdly we have the aortic opening, which is not a true opening as it is not piercing the diaphragm as such, but yes, it is lying, the aortic opening is lying between the two crura of the diaphragm. So if I would say out of the three which one is not piercing the diaphragm, so yes, this aortic is not exactly piercing the diaphragm, and hence the structures which will be passing we will be seeing now in the subsequent time. Those structures are the only ones which are not piercing the diaphragm as such. So I think now you all are wondering what are the structures which pass through these openings. Yes, we have already discussed, but yes, for your exam purposes and for knowledge, there are certain other structures also which are not linked with the name of the opening, but yes, they pass through these openings. Let's see the structures passing through these openings. First, we talk about the vena caval opening. We have the inferior vena cava, which you are already aware. Also, notice there is some yellow structure which you can see. This is nothing but the right phrenic nerve. Again, very important to note, and it is multiple times asked in Viva as well as MCQs. The second, we have the esophageal opening, and the arrow marked structure is the esophagus itself. You can very well appreciate it is between the muscular part of the diaphragm. and this explains the action of the same. The structures which are passing through this esophageal opening are the esophagus itself, also the vagus nerve and the esophageal branches of the left gastric artery and vein. Again, very important structures which are passing through this opening, especially the vagus nerve, which is repeatedly asked in the exams. Then we see the last major opening, third major opening, which was the aortic opening. And the structures which are passing through are the major structure being the aorta itself, and the rest of the two, the thoracic duct, again a very important structure, and esophagus vein. So we have these three structures which are passing through the aortic opening. Very well, so I think now you all are aware of the structures passing through these openings, the name of the openings, and at what levels they are. Recapitulate what we understand in this video. So we have a summary of the major openings of the diaphragm, the 1, 2 and 3. The vena-caval opening being at T8 with the structures passing being the inferior vena cava and the right phrenic nerve. Second one being the esophageal opening at the level of T10 with the structures being the esophagus, vagus nerve and esophageal branches of the left gastric artery and vein. And the third opening being the aortic opening, which is lying at the level of T12. The structures passing through it are the aorta, thoracic duct and esophagus vein. Again, to highlight, the third opening, this one, is not the true opening. It's not piercing the diaphragm. So if someone asks you, what are the major structures which are not piercing the diaphragm? Yes, you are aware of this. They are the aorta, thoracic duct and esophagus vein. Thank you all for listening with great patience. That's very important. So I guess now you know the anatomy behind what the patient suffered from. Yes, the patient suffered from a hiatal hernia that was nothing but the stomach being protruded from the esophageal opening in the diaphragm. It went from the abdomen to the thorax. So hence the gastric bubble which was present in the stomach normally should have been present in the abdomen region. It was seen in the thoracic region, superimposed on the cardiac contour. So hence we saw the X-ray, so we can correlate now our anatomy knowledge with the case which we just discussed in the beginning. Yes, now I think you are aware of the structures, and thank you so much. See you in the next video.